normally wait. Do you want to wait another minute or two, or should we get started, Ian?
Think let's get started.
Okay, great. Um, Thanks everyone for joining us at this joint seminar. It's a joint seminar with the Johns Hopkins Center for Clinical Trials and Evidence Synthesis and the Center for Drug Safety and Effectiveness. My name is Karen Robinson. I'm a professor in medicine, epi, and health policy management, and we're delighted to welcome today Dr. Katherine Wu. Dr. Wu is a staff writer at The Atlantic. Before joining The Atlantic in 2021, she was a science and health reporter for the New York Times, focusing on COVID-19. She has won a Schmidt Award for Excellence in Science Communication, a Science in Society Journalism Award, and the Everett Clark Seth Payne Award for Young Science Journalists. Dr. Wu holds a PhD in microbiology from Harvard and has written extensively on a range of topics related to science, including writing extensively about vaccines, vaccine clinical trials, funding and coverage for vaccines, as well as risk communication related to vaccines. Dr. Wu's talk today is covering vaccine clinical trials and risk in the media. Um, and I just wanted to say we hope to have a good discussion at the end. So please feel free to put questions or comments in the chat. And then at the end, we'll ask you to raise your hand. So with that, welcome, Dr. Wu, and thank you for presenting as part of our seminar series.
Yeah, of course. Thank you so much for inviting me. Happy to be here, though. I will sort of start this off by acknowledging that I am not the typical presenter that I understand you have in this series. I do, as Karen mentioned, write a lot about vaccines, and as part of my coverage, I have written about clinical trials and safety testing and the deliberations of committees like VRBPAC and ACIP, but I don't exactly consider myself a subject matter expert in, any of this stuff. I consider myself someone who knows who to call when I need to reach subject matter experts. So my goal here today is not really to tell you anything, certainly nothing data-driven about medicine or research or public health that you probably don't already know, but just to share my perspective as a reporter who touches on these topics often and the challenges I encounter when I'm writing about these topics for audiences that usually have almost no background whatsoever. And I do want to leave time for questions and discussion. Uh, you know, I will leave most of that time for the end, but there will be a couple pauses along the presentation where I'd love to hear any thoughts that you have. Um, but hopefully we have a great chat today. And again, thank you for having me. All right. So, uh, I think the job of journalism is a very interesting one. It can be a very high stress, high paced environment. And, coming from the academic environment myself, I found it really jarring, honestly, at first. This was a world where, there's really a premium put on stories that are big and you have to talk about them very quickly. Ideally, you're telling really exciting stories that have a clear beginning, middle, and end. You have to keep the reader engaged, and ideally, they come away from that story having a clear understanding of what's going on, a clear takeaway. This is what happened. This is what I should understand about it, and this is maybe how I now feel about it. And hopefully, some of those takeaways, are true for the relatively long term. And, some of the best stories highlight dramatic characters that have dramatic things happen to them. And you can say, almost, wow, that was a really great piece of gossip that happened to make the news. Um, that's very tricky for a lot of science journalism when a lot of science, especially the science that I cover, looks like this or looks like this. Um, a lot of these papers and concepts don't lend themselves very clearly. And, science is, of course, as we all understand it to be, it is premised in having a lot of complexity and
Mm.
nuance and heterogeneity and gradients rather than binaries, and everything comes with a caveat. This experiment worked on a rainy Tuesday afternoon, but I can't 100% guarantee it's going to work tomorrow, especially in a different population under different circumstances. And those are challenging concepts to convey. Admittedly, I think you lay out too many of the nuances and readers go right to sleep, or maybe even worse, they click away from the page entirely and don't get the full story. And I think that's part of the reason that up until a few years ago, it was really, really, really unusual to see science-themed stories on the front pages of newspapers or, on the home pages of big news websites. Science was a very hard sell in a lot of cases, not all cases, but in a lot of cases. I think we're certainly all aware of one of the big examples that changed all of that. COVID was such a striking science story that affected all of us so very strongly. Science had to be front page news. It was a matter of life and death. And it required people in the general public, many of them who didn't have science degrees or an interest in science in high school or middle school, much less advanced science degrees, to really understand some very complicated topics. It was a bizarre time when we suddenly, I was on the science desk at the New York Times at the time, and the desk had very quickly gone from this very sort of sleepy place where sometimes we would write about how crazy squirrels were to all of a sudden every 5 minutes something new is happening, and big developments in vaccine trials were suddenly triggering breaking news alerts, and all of a sudden members of the public knew what ACIP stood for, and people were asking questions about neutralizing antibodies and T cells. And it felt like all these different worlds were colliding. The stakes were so, so, so high, but that meant that everyone in the public really, if they were to see these topics in the news, they also had to understand them very quickly. And if they didn't, they risked not fundamentally understanding something that could really impact their health and others. And so it was a really tricky moment for science. I think, if we all think back to that time, so many of us were so desperate for good news and clarity and hope, but that was so hard to find at a time when the situation was changing so rapidly on the ground, and there was a lot of misinformation creeping in from all directions. And I think, there were, of course, great intentions all around, but this environment made it really easy for miscommunications to happen. And I think one of the biggest ones that was very much well intentioned, but had a lot of challenging consequences was, when the CDC and a lot of public health experts in the urgency to get people vaccinated when the first COVID vaccines came out, they billed the COVID vaccines as a free ticket out of the pandemic. There's this promise of the efficacy is sky high and everything is 95% effective. And there wasn't a lot of specificity about, well, effective against what, for how long? And the idea was, you get your vaccine, you take off your mask, and it's over. This is life after COVID. It's before vaccines, after vaccines. That's it. And there just wasn't enough discussion about the possibility of what if this doesn't last? What if effectiveness wanes? What if people do get infected or even quite sick after they get vaccinated? What happens if the virus itself changes? Um, the messages being sent instead were look at these incredible numbers, and they were incredible, but there was a lot going on beneath the headlines that wasn't easy to talk about in this rush to get everyone a little safer. And so I think it's really understandable that a lot of people felt very confused and even betrayed when they started seeing vaccinated people getting sick, when they started seeing changes in guidance saying, actually, the mask probably has to go back on for some time. And I think it made it easy for more misinformation to creep in, for people to instead not fixate on how well the vaccines are doing their intended job, which is, to prevent the severest forms of disease, and instead fixate on, wow, there's some really bad side effects that come with some of these vaccines. Or wait a second, we got these vaccines so quickly. What's up with that? I thought this was supposed to take years. Did we take some serious shortcuts here? Um, and here, I do want to pause and, with hindsight being 2020 or close to it, I'm curious if anyone in the virtual room here just has any thoughts about what they wish public health could have done or said differently, how possible that would have been with the information we had at the time, especially, I'm thinking back to like November and December 2020. We had just gotten these trial results from Pfizer, Moderna. Um, what was possible and what difference would it have made? Do you think as many people would have rushed to those vaccination sites and, waited for hours outside of CVS and Walgreens? Um, what impact would it have had on COVID vaccination long term? If anyone has thoughts to share, I'd love to hear them. Otherwise, I can just speculate a little bit myself. But I welcome any thoughts anyone has. If anyone wants to unmute and jump in.
Hey, give me 5 minutes. I'll call you right back. All right, bye.
Um, I don't pretend these are easy questions. Maybe uh, that leads to, this being a really tough set of questions to answer. I think it's probably true that if there had been more caveats presented up front, people probably would have been confused. People respond really strongly to clear messages, get vaccinated. These vaccines are amazing. End of story. It's part of the reason that I think all of the possible side effects, even at the end of, drug commercials, are said at 4x speed and in tiny, tiny, tiny print. It's not really what people want to hear up front. They want to hear about the benefit. And I do think, with more uh, upfront discussion, it would have been probably good to have that, but it might have also um, made it more challenging to get people vaccinated, and it might have led to a lot of questions that were not easy to answer. So I don't pretend to know exactly what the right path forward was, and I imagine no matter what, it would have been challenging. I do see some things coming up in the chat, and I'll just read a couple of these um, out loud. Someone says, ideally, public health maybe could have created a chain of trust and disseminated the information in a way more simple manner without being sciencey. I think that would have been fantastic. But yeah, the big question is how. Um, and right, being more clear about what a vaccine can and cannot do. Yeah, and too many assumed it means you would not have get infected. That's probably the number one thing I wished had been clearer from the start as well. But it is challenging, right? Because some of the initial numbers were touting effectiveness against infection or any symptomatic infection at all. I think the messages were mixed from the start, and we saw so many headlines that said it's this percent effective. And, it was like, oh, you assume it's over. And of course, if, you're supposed to be able to take your mask off after vaccination, doesn't that mean infection isn't really a risk anymore? I think these are great points. Um, okay. Uh, but I think the reality is there were some of these miscommunications and confusions, and it has really affected how people have come to perceive vaccine sense. And I'm certainly not just talking about COVID vaccines. I think, what's really interesting to me is we've seen that uptake for other vaccines has actually declined since the start of the COVID pandemic. And it is related to how politicized those vaccines became and how much that sentiment started to bleed into other vaccines. I think people started to really question, well, wait, what is going on with these vaccines that I have been taking all my life and that I have been giving to my children? And they started to wonder, what does effectiveness mean? How long is this protection going to last? And do I really need it? Um, and I think, misinformation is really powerful when people are scared and confused, as they very much were at the absolute height of the pandemic. And, when science is sort of defined by nuance and iteration and exceptions, misinformation comes in very, very early, and tends to dominate because it is premised on simplicity and definitiveness and consistency and plays on people's emotions. Oh, you're afraid of harming your children? Well, I know for a fact that vaccines are not safety tested and they are bad. To make statements like that, they sound so definitive, they sound so clear cut. And in some ways, they can also sound unquestionable, which is a point that I will come back to later. And, these issues are, of course, so pertinent beyond the pandemic. itself, because we're seeing these issues really reignite now in 2026 and of course last year in 2025. And it's maybe even worse, right? Because it's at a time when the government has often been the source of some of the most confusing and conflicting messages about vaccines. Some of the nation's top health officials are spreading fear and confusion about the side effects of vaccines, the risks of vaccines, and we're hearing very little about the benefit that these injections have given people for decades. Um, and I think, some of the most interesting ways that these messages have been put out there is, I think, by sort of it almost presents the inverse issue of what we saw in how COVID vaccines were advertised, maybe to a problematic degree, right? It was all about the benefit. This is what we see. That's good. These vaccines are incredible. Here's what they're going to do for you, and that's just it forever. Right now, I think what's really interesting is a lot of the vaccines that have had doubt cast on them, including by members of the administration, they're focusing exclusively on the risks. There's not a lot of discussion of pros versus cons, risk versus benefit. It's risk, 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 risk. And a lot of this information is not coming from good sources. But some of the people that I've talked to about how they're sort of perceiving this from the outside have described this as, it's very interesting to see a lot of what should be, expert data-driven discussions of vaccines turn into what they describe as vaccine safety theater. People gathering in a room and saying, well, I have some questions and concerns about this vaccine. I don't think they have been adequately answered. It makes me worry about the risk we are imposing on our children. And again, this sounds inarguable, right? Like, why are we putting our children in some kind of danger? What is going on here? And I'm just asking questions. Um, in a world where I would say, hopefully, everyone is concerned about the well-being of their family and their loved ones, it feels like an inarguable point because, again, it plays on emotion. And, it focuses on the dangers where it's really, really, really easy to get people to feel doubt if you just play on their fears immediately. What we're hearing sort of across the board is safety testing has been inadequate. The government has buried data on serious side effects. Like, no one is telling you what is really happening with these vaccines. And a lot of the supposed issues that are being drawn out of these discussions are ones that, play on fears about really poorly understood developmental conditions in kids. They're really leaning into the space where there's ambiguity and trying to find purchase there with anyone who has any doubts or concerns or just basically not know enough about vaccines.
Did I just stop?
Um, and I think what is a little challenging for me as a reporter is, trying to acknowledge that risks, of course, always do exist and ambiguities always do exist. I'd never want to be in a position where I'm telling my reader, like, we do know everything and the case is completely closed on every product that we have offered to the American public, because there are some absolutely true things. And this is just true about how we pursue knowledge and how data works, and also just how trials can ethically or not ethically be conducted. For instance, it's not really possible to fully prove, well, it's not really possible to fully prove anything, depending on how you define fully prove. But, for instance, we haven't, I suppose, 100% proven that vaccines don't cause autism. The data points strongly and very, 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 very strongly in one direction. But, it's not ethical, for instance, to conduct a clinical trial where you leave a bunch of children unvaccinated, vaccinate a bunch of others, and then just follow them for the rest of their lives. I think some people in the administration would love to see that happen, but there's a lot of complexities in how exactly we can ask and answer those questions. The data on thimerosal, a preservative that ACIP advisors, voted to be purged from flu vaccines this past year, in a similar way, has not completely ruled out every single possibility of any possible adverse developmental effects on children. And, all this really just points to the idea that no vaccine and no health intervention is 100% risk-free. These are all technically true. And so I think when people raise these points, you do have to acknowledge that there is always risk that we are asking people to take on whenever they take any kind of health intervention, not just vaccines. But I think the problem is that these statements have been sort of amplified at the expense of all of the statements on vaccines, and they've sort of been used as an excuse. Well, if these things are true, then how can we possibly accept any of these risks? What I do try to do in my reporting is, emphasize what I mentioned just a minute ago, which is that, even though there is no way to say everything is 100% definitively this or that. It doesn't work like that. But the data, again, strongly points in one direction. And we do have to take into account where the wealth of evidence points. If there's very, very, very sparse or even non-existent evidence pointing in the other direction, that does have to be something that the public hears and hopefully understands. And then, of course, the bigger picture of, even though risks exist for literally any action that we take, including me sitting in the chair right now, me getting into my car later to pick up my child, there is a benefit that often outweighs that risk. And that is the point with any intervention that we ask people to take, or at least it ideally is. And I think these are not easy concepts to tell the public. It's not easy to, for instance, pause in the middle of a news piece and go through all of the different points that I'm trying to make in this talk. But I do try to make sure that people have the opportunity to think through these concepts, and I try to avoid, whenever I can, the sort of broad, overreaching statements that I think may have gotten us into some trouble in 2020, 2021, and beyond. So I think part of the way to do that, and again, I think this is something that is tricky and something that I am constantly thinking about all the time, is how to acknowledge risks, including and maybe especially around vaccines. And I think, I look to how the federal government has handled this reasonably well in the past in having, you know, a vaccine injury compensation program, which acknowledges the existence of very rare but very real adverse side effects that can come with some vaccines, having a clear compensation system for that. And ultimately, I mean, I'm sure you all know this is something that both protects manufacturers and also makes people who have been genuinely vaccine injured in an evidence-backed way feel validated and feel as though they are accepting a risk that will be acknowledged by the federal government. And this is not something that I mention explicitly in all of my reporting, but this is sort of a principle that I keep in mind and try to help guide my reporting. These risks exist. It does not serve anyone to fully ignore them. They should be acknowledged when pertinent. The goal is certainly not to overblow them or to talk about them when they're not relevant, but acknowledging them is the best way for people to feel heard and feel like they're not being condescended to. I'll pause really quickly here before I get to a few more concepts that I wanted to talk through. Does anyone have any questions, or if you want to drop some comments in the chat, I'm happy to read those. I think we got at least one. One person did say a message on how vaccines are different and why some prevent with 1 to 2 doses for X years versus why a yearly flu or COVID vaccine may be needed. The general public does not understand how they work, and recent generations don't know the complications of measles, polio that a vaccine would prevent. Okay. So I think where, and I repeat myself only because this has become such a big guiding theme for me. When I do write about vaccines, which I do often in this day and age, I am never trying to say all vaccines are 100% safe or all vaccines are worth it for every single person under every single circumstance. I think the absolute statements are where we get into trouble and where misinformation finds a lot of ground to be gained. What I have tried to think about instead, especially at this particular moment in time, is framing vaccines or really any health intervention that I write about as not perfect, but worth the risk. Even like, the risk in some cases may be so infinitesimally small that it's barely worth mentioning. But, this basically makes it necessary to discuss the risk of not taking the vaccine at all or delaying the vaccine or not completing your dose series because the risks are so immense for so many of the diseases that we are trying to prevent. And I think it's a good time to reflect back on the comment we got around 1220 about, the complications of measles, polio. People don't remember these things. And these are things that my colleagues and I have been writing about extensively because we do live in an era where we are, 50, 60 years past the time when those diseases were infecting every single child because there was no available vaccine. And what people need to know, and themes that I try to bring up regularly in my reporting when I do write about vaccines, ways I think to convey that is just that, safety testing absolutely does occur. This is a primary goal of how we understand and, greenlight vaccines. Trials wouldn't even proceed if the products they were testing weren't safe enough for a healthy population at baseline. And, these discussions can often take months and years. And if something is problematic, trials will pause. I've tried to remind readers even recently that trials have been paused even recently and that products have been pulled off the market when they have found to be unsafe, whether during those trials or after those products have gone to market. And, one thing I have been thinking about quite a lot lately is how to sort of write about safety testing in a way that will actually make people feel like this is a relevant thing to come up. It's tricky because we don't have that many high profile vaccines coming to market right now in a way that makes it easy to write about safety testing. But when people, retroactively say, like, how do we know, for instance, the measles vaccine is safe? A lot of that research happened a long time ago, but I also try to remind people that in a way, safety testing has been going on ever since then because we've been watching billions of people get those vaccines and everyone has been doing great and not getting measles for the most part. I think another thing to emphasize is, a little more on the sort of philosophical rather than just the hard logistics side. But just for vaccines in particular, this is a really counterintuitive concept for people, I think, especially in a fairly individualistic society like the US is. We're not just talking about the benefit to the individual, but to the entire community. When more people take vaccines, more people are protected in a way that is synergistic effectively. And it's not something that people are used to thinking about when we're used to interventions like, oh, I have a headache, I'm going to take Tylenol. If I wear a helmet when I ride my bike, I won't crack my head open. We are very centered on the direct benefit to ourselves, understandably. But it's a concept that is really worth reminding people of, especially for vaccines, especially when more infectious diseases are starting to spread. We come back to this word that is so vague and yet sometimes so precise: effectiveness against what? This is something that I started doing. I want to say sometime in 2021, but I can't pinpoint an exact time when I started doing it. Whenever I put the word effectiveness in a piece, I tried to mention against what? Against infection, against severe disease, against symptomatic disease, against straight up death. This is a really relevant number to tell people. And they do want to know. I think what has been a little tricky is even when companies advertise their clinical trial results, they're not always incredibly specific in their press releases. You really have to dig through the data and talk to the researchers themselves to ask, what their endpoints were, what they were measuring against. But I really try to find this information to make sure that I'm able to tell people, like, here's what the vaccine was designed to do. Here's what the researchers actually looked at, and here's what they were testing for. Because again, I think people still default to this idea of getting sick to any degree means the vaccine didn't work. And to sort of break that assumption, I'm trying to remind people in these subtle ways that that's not always well, that's often not how a vaccine is going to work. Um, and I think in general, this is an idea that I keep coming back to. Just the idea that no intervention, no decision is completely risk-free, nothing is perfectly safe. And so the goal is always to think about what risks are acceptable given what we're trying to protect against. And the most challenging thing, I think, comes back to this idea that is very related to the individual versus community benefit. The idea that with vaccines in particular, we are trying to prevent something. We're asking healthy people to take on an intervention to guard against something bad that may or may not happen in the future. And we can't exactly say when, how bad it's going to be, how many people it's going to affect, how long it's going to last. Here, especially, I think with modern medicine in this country developing the way that it has, there is a really treatment focused mindset, right? We feel badly, we do something about it. It's much less about, I'm going to take this action now so that I will feel better and be more protected the rest of my life. I mean, this is one thing that I do actually agree with the administration on, that, this mindset has, made it more difficult to tackle chronic disease in this country. I wish that same thinking could translate over to vaccination, because it really is so much of the same concept that, vaccination needs investment, or infectious disease prevention needs investment upfront. These are, again, big themes that I'm always thinking about. I do not always put these exact statements in my pieces, but these are guiding principles that I am always trying to keep in mind. And then the last thing is really just change is inevitable. It may sound strange or counterintuitive, but one of my favorite things to hear from the researchers I interview is actually the phrase, I don't know. Because one, it sort of reassures me that they are comfortable sharing the limits of their own knowledge. And I say, hey, okay, great. Who can I talk to that would be able to answer that question? Or if the question is truly unanswered because science hasn't gotten us there yet, that's useful for the public to know, right? I think science is much more about the process of seeking knowledge than, knowledge being some sort of set in stone, permanent set of facts. And that's something that I also try to keep in mind when telling people something. For instance, the effectiveness of COVID vaccines literally did change when new variants appeared. That was something that did change. And I think people would have been caught less off guard if this sort of iterative idea were more present in news coverage. Okay, I think that is everything that I had to say, but I would love to open this up to discussion, and see if anyone wants to talk about anything from this particular presentation, or I welcome questions about other parts of my job if that's useful to anyone. Yeah, I mean, I'm here to tell you whatever you think may be useful for your lives.
Thank you so much. That was really interesting. I was jotting notes while you were talking. Please feel free to raise your hand, and I'll make sure, see if I can see you, or put questions in chat. Maybe I'll start with a question that was just prompted with something you just said, and that you mentioned interviewing experts. How do you identify or select the people that you end up interviewing?
Yeah, it's a great question. I think it really depends on a few things. One, the timeline I have. Sometimes if I only have a few hours, it is a much more frantic and haphazard process than I would like it to be. If I have days and days, I can really spend time going through all the methods that I'm about to list. But there's a few sources. One that I do not necessarily turn to first because it can backfire is seeing who has been willing to talk on the subject before and is a credible subject matter expert. I say that this is kind of a fraught one because, one, I try not to just turn to the same people over and over and over. I think there is a danger of, people becoming effective science pundits. We did sometimes see this during COVID, and people ended up sometimes speaking outside of their realm of expertise. That can be certainly dangerous. And sometimes I go out of my way to not quote the people that have been quoted over and over because I am just desperate to hear someone else's perspective. I already know what those people are going to say. Depending on the topic, if it's something, quite niche, I very, very, very often go to PubMed and I look up review articles on the subject, and I look up, the first and last authors of those papers, or if there's like a really recent breakthrough, someone who's very tapped in and has, been keeping up with the literature, or I suspect that they are, and I'll reach out to them. I very often ask people for recommendations of, whom else to talk to, especially if, I'm exploring something that I have never reported on. I really want to try to cover my bases, and sometimes I'm missing, the number one person who knows everything about lymphoma, whatever it is that I'm reporting on that's somewhat new. Um, and I actually have tried to make a big effort. It doesn't always work, and I don't always have time for it, but I think the default has been to quote, if there's like a research study or just a big topic that requires a lot of voices to go to the PIs of labs or the CEOs of companies or whatever the case may be. And that is useful, but they're often not the people who are in the lab doing the work. I really enjoy talking to postdocs, grad students, and, especially, younger scientists who, frankly, are not all old white men. I feel like you tend to get a very specific perspective when you limit yourself. And some of the best stories, some of the best characters in my pieces are kind of the other category.
Yeah. I see there's a question in the chat, but I'm gonna take the prerogative and just ask you a follow-up question, if I may. So sort of from the other side, and I will say that I'm maybe coming from my own PTSD in this. But how do we, if somebody like you, especially for politically charged or sensitive topics, is reaching out to us to ask us for an interview, how do we know that you or your colleagues are legit's not quite the right word, but aren't coming with a set agenda, are going to hear us and write a fair piece? How can we, from the other side, how should we respond to a request for an interview?
Yeah, I mean, I obviously speak from a biased perspective because I want you to respond to me, but it's a very fair question. I mean, I think not every reporter adheres to the same set of values or practices, and um, I think there are also situations in which reporters are put in tough situations. Like if someone is used to reporting, like, from the New York Times Metro desk, and they're all of a sudden, like it's a pandemic, and they have to report on COVID testing and they have never heard the word antibody before, I think they may be more prone to errors just because it's a brand new situation and they're on a really tight deadline. I do recommend, people give reporters the benefit of the doubt. It is usually worth the risk to talk to someone new. What the best you can do is uh, stick to what you know is true. Emphasize what you don't know and say what you were comfortable speaking about. And the rest is a little bit out of your control. But I do also recommend looking people up. If you're familiar with their outlet, that can guide you to a sense. If it's an outlet you've never heard of, I would do a little bit more work. If it's you can always look at someone's list of bylines and look up past coverage. You can get a very quick sense for, where they stand on vaccination, where they stand on particular people, if that is something of interest to you, how they've handled coverage in the past. And also, if you have time, ask your colleagues, have you ever heard of this reporter before? Do you have any sense for where they're coming from? But I mean, honestly, that can take a lot of time, and a lot of times reporters need to talk to you right now. I do generally encourage people to take a leap of faith. Though, in 2026, I would be remiss not to mention the fact that I know it's a really sensitive time for a lot of people. I have never in my career, in the past year, I would say I have granted anonymity more times in the past year than I have throughout my entire career otherwise, right? People are afraid of speaking out and losing funding. People are afraid of speaking out and getting fired. It's hard. And I think, especially for people affiliated with big institutions, they haven't sometimes been warned by press officers, like, be really careful about what you say. Like, we don't want to be next on a hit list. So I do understand the position that people are in, but I think that also puts a premium on this moment, on like it's really valuable to have honest perspectives from researchers who are living through this reality and who are watching expertise being attacked from all around. I've been really like, I wouldn't be able to do my job without the people who've been brave enough to speak out.
Thank you. That's very helpful.
Mhm.
So a question in the chat, how can we combat the misinformation out there about vaccines?
Yeah, kind of one of the eternal questions.
Yeah.
Yeah, I mean, I would say, just to be slightly self-serving, respond to journalists when they call you. I'd say a lot of them are trying to do exactly this, but I think it's also been really heartening to see a lot of scientists like taking to social media. Like they will actively, like if they see something going viral that is absolutely full of misinformation, they'll respond to it. They will try to engage, and the goal is certainly not to. I think a common thing that I still see is ad hominem attacks, like, oh, this person sucks. They're not credible. And that could be someone's aunt, that could be someone's best friend. And I think if you go after the person, it makes some people very much less inclined to listen to you. I think, in the same way that like a lot of journalists try to do, or the way that we write our manuscripts, for instance, it's to engage with the facts of the situation rather than the people. I think it's good to acknowledge feelings but not to center everything around feelings. Like I know you must all be scared about the health of your children, and you must be all be scared because there's been a lot of confusing information shared about X, Y, or Z. Here is what we understand, here's what we don't understand, and here's what I hope you can take away from it. And also open yourself up to questions if you feel like that's something you have time for. That does not obligate you to respond to every email that you get ever from a random person. But I think just being willing to engage, I think where a lot of the issue comes from is a lot of misinformation sources are not coming from within academia, right? Like they're coming from someone who sent you an email thread. It's coming from, a relative, a close friend. They're coming from sources that people are already inclined to trust. And I'd say mostly the American public still feels very distanced from people who are considered experts, especially in science, vaccines, public health, right? Like these are things that most Americans have not had the opportunity to engage fully with. Um, and I think we're hopefully starting to see a shift in that as more scientists and researchers are trying to engage and level with people and speak to them, on equal footing rather than I know better, end of story, just listen to me because that other person is a whack job. Not accusing any of you of that, but it is something I have seen even quite recently. It's usually not helpful.
Thank you. Again, please feel free to raise your hand and or put questions in the chat. One thing I was struck by early on in your presentation was about what made an attractive story for you or your editors, like compelling character, relatable character, that sort of thing. Um, from your perspective, how could we make our stories, so our research, how can we make our messaging more attractive or palatable or clear from our work?
Yeah, I think a lot of good reporting draws on the elements of good storytelling. And I try to remind people that we are all natural born storytellers. Like from the time we're toddlers, we, say like, oh, like mom, dad, something exciting happened today. And like, this person did this and then I did this. And like it felt crazy or like it was fun or it was horrible, right? We talk about things that happen. We talk about interesting characters and we talk about our emotions and our reactions. And often in a story, like something changes. I learned this, or, I never did this the same way again. Um, Generally, good stories have those elements too, right? And so I find it really exciting when someone is willing to share their personal story with me. Like, I was about to give up on this project, and then I did this one crazy experiment that involved like a bunch of rat placentas, and like all of a sudden, like everything changed, And when people share their experiences, their emotion, their hardship, the mistakes that they made along the way, it only makes them seem more human. I think the narrative that most people are still most familiar with in the public, even though it's not really an accurate one, right? It's the like eureka moment, the lone scientist in the lab who like makes the discovery, and there's no discussion of the process, the challenges it took to get there, like the collaboration. Those stories are really important. I'd also say like anytime that I'm able to find, a patient who's willing to talk, like uh doesn't have to be the patient talks, but like one recent example is like baby KJ. Like, I mean, if you have a really clear cut example of like something revolutionary, gene editing, CAR T, whatever, if you find someone who's willing to say like, my life was horrible. Science helped me change it into something less horrible. That's very compelling, right? Like science is an agent of change. Something happens in that story. You sympathize with the person. And that makes for really good, memorable storytelling, or at least it can. I know that's not always easy for every scientific discovery, and not everything lends itself to that, but that can help. Even in small ways, I think whenever researchers are able to say something as simple as like, I was excited or I was extremely frustrated, it can add color to a story. It's not just about the data. One pet peeve of mine is when people say, like, I don't want to talk about it, just let the data speak for themselves. Like, sure, but science is also done by people, right? And there's a reason that people put their names on papers. There's a reason that, we cite each other. There's a reason that people give talks, right? People want to hear from the sources themselves. They want to be able to ask questions. They want to be able to engage with the process of it. And it's not just, otherwise, everything would just be the results section and we'd all walk away.
Yeah. Can I guess a related question is, how do you come up with your story ideas or topics? Are they mostly from you? Do scientists or researchers reach out to you? What's kind of the proportion of reactive
Mm.
versus proactive, if I can use that?
I'd say this is an answer that's kind of specific to me at the Atlantic. Because, for instance, when I was at the Times, well, okay, I'd say it's a combination of the outlet, the reporter, and the general chaos of the world around you, right?
Mm.
I'd say like in June of 2020, when I was at the New York Times, it was like drinking from a fire hose, right? Every idea was coming at me like bombardment. I didn't have to like sit here and think about like what's happening in the world today and do I have anything to say about it? It was just nonstop. Sometimes I'd be working on 5 stories at once because that's how much was happening and how much our desk was being inundated. And editors were messaging me constantly and saying, "This happened. Did you see this?" Or I'd see something and say, "Oh my gosh, like that's crazy." It just it felt like I never had to think, just do. Um, I'd say like, I mean, the Atlantic is slower. We're not a newspaper. And I think I more end up doing, commentary or perspective sharing. And so I do have more time to sort of think about what's interesting. What are sort of the big questions? Is this enough to warrant a story? Is it just like a very tiny iteration, or is it this something that could change the way that people think about X? And if not, I often don't cover it. So I really do spend a lot of time just thinking about what is interesting to me and what makes me like a cutoff for me is this interesting enough to be a true story, or is it just barely interesting enough to be just like, oh, it's a tweet and then I'm done?
Mm.
Um, does it need more than that? Is it a little anecdote I share at a party, or is it, the big story I would be like open to telling at someone's wedding, for instance? Just like ways like that. Is this really a game changer? Um, but I'm lucky in that I think at the Atlantic, I more often just kind of get to follow what interests me. I don't only cover vaccines. I don't only cover infectious disease. I sometimes cover, what's going on in the world of wildlife and conservation, or just, a very bizarre health story that catches my attention. Um,
So
but, at other outlets, you'll hear a very different combination of how people get their assignments.
yeah, I guess one thing I'm curious about is, I know that, we're encouraged to work with our media office, JSU Media, and
Hmm.
they will sometimes put out press conferences about, or not press conferences, press release about a new study or new publication. Do journalists pay attention to those? Like, is that a source of topics for journalists, or no? Not so much.
I'd say most journalists will be reading those pretty frequently, but I'd say the rate at which we actually do anything with them is probably not as high as a lot of researchers would like it to be. It's probably more in like, well, for me at least, I'd say it's of all and I get a lot of press releases, so don't be intimidated by this number. I really think it's in the single digit percentages of like ones that I follow up on.
Wow.
And that is truly partly a product of how many press releases I see in a given day. Like it is dozens, and I am not doing dozens of stories a day. Um, but sometimes I do seek them out. There are, places like there's a site called Eureka Alert where you can post, embargoed versions of papers that are coming out in the next week
Hmm.
ish. I do sometimes look through there. And there will be press releases written either by the university, or like the journal itself, like Cell, Nature, Science, like most of the big journals put out their own sort of press packages.
Mhm.
Uh, I will say I did more of that when the world was not falling apart, either because of COVID or because of the Trump administration. During peacetime, I'd say that's a bigger source for stories.
What was it called? Eureka?
Eureka alert, like Eureka, but it's a portmanteau with alert.
Oh, okay.
Yeah.
Interesting.
Um, yeah, but I think the trick is, and again, this is partly a product of the place I work for, the Atlantic. I'd say newspapers are maybe more often likely to do a single study story, right? Like this was a paper that was published today, and here's what it said. We've really raised the bar for covering those sorts of studies because I think so many, like as is the nature of science, like so many papers are iterative, right? Is this enough to really change people's thinking about X, Y, or Z topic? I do like writing those stories, but I just have not done very many of them in recent years. So I think that is also another reason that I don't often base stories off of single press releases.
Yeah.
Yeah, it's just the nature of where I work.
Okay. Any other questions for Dr. Wu or any other comments? No? Okay. Ian, do you have any last words?
No.
You're the only other face I see on my screen, so.
No, just extending my thanks to Dr. Wu and to everybody for attending.
Yeah, thanks very much, everybody.
Okay, well, thank you so much for having me. I hope this was useful for everyone, and yeah, great to meet you all and have a great rest of your day.
Yeah, it was great. Thank you very
Thank
much,
you very
Dr.
much.
Wu. It was great.